welcome to Some of Your Parts podcast. I'm your host, Dr. Betsy Greenleaf, premier pelvic health expert and women's wellness warrior. Join me as we discuss women's wellness topics and discuss tips and tricks with top elite health experts, and where you'll discover that you're greater than the sum of your parts. On today's show, we'll be speaking with Dr. Afrouz Demeri. Since 2007, Dr. Demeri has been helping patients with their health problems. Practicing as a licensed board-certified naturopathic medical doctor, she specializes in integrative functional medicine for women, where she finds the root cause for hormonal balances, thyroid disorders, stress, weight or digestive issues, fatigue, depression, and anxiety. As faculty and director of functional medicine at the University of California, Irvine, she practices both at their Integrative Health Institute and in her own private practice in Newport Beach, California. Above all, Dr. Demeri lives to nurture. Because she was sick and her children have experienced sickness, she's come to learn the importance of the role of women play in health for themselves, for their family, and for the world. She's learned how the foundation of health starts in utero or even prior to conception. The healthier people are, the more they can live a meaningful, soulful life. She's been featured in publications such as Women's Health, Now Magazine, WeightWise Expo, and Vitality. When she's not helping patients, she finds her own lifelong wellness, studying yoga, cooking for her family, teaching or dancing at a local gym or Zumba studio. Today, we will be talking about Trimester Zero. Basically, how to have the healthiest children and our healthiest future by starting with your own health before even conceiving. It's great to have with us today Dr. Afrouz Demeri.
Yeah, so I started wanting to be an actual surgeon. I always knew I wanted to be a doctor, and I was pre-med, and like I said, I was put on birth control pill because I had acne and all kinds of irregular cycles, painful cycles, spotting here and there. And I was put on it to regulate my hormones, but I didn't know that it doesn't actually fix your hormones. It just kind of shuts everything down and takes over.
Yeah.
So I had no idea of the risks. I became a bit more depressed. I was very anxious. I gained weight. I started eventually after 3 years getting migraines, biliary migraines. And so then I was put on more meds and more meds. And I thought that was cool. I thought it was nice to be on meds. I wanted to be a doctor. I thought that's what we did. But I've forgotten traditionally, my grandmother being in Iran, we always had herbs and teas pretty much for everything. Anytime we had a health problem, she would say, eat more of this, or your liver's not doing well, you need to eat more of this. And so I sort of forgot, that that's how I was raised. And I started talking to her, and she was like, this doesn't sound very healthy for a 21-year-old, for you to be on all these meds and, not really getting healthier. Do you really think that's health? And so the whole idea of health versus disease, when your body tells you first something is wrong. And for girls and boys, I find it really starts in puberty. Nowadays, I'm finding so many of them have symptoms, but the parents or the doctors don't really know what to do with it, and it's considered normal, but it's not really healthy, right? Just because everyone has period pains and cramps and guys get acne, that doesn't mean it's healthy, right? So fast forward, a friend of mine said, why don't you go see a naturopathic doctor? And I said, a what? And I'd never heard of one. And this was a European doctor who was trained as an MD, but also knew a lot about Chinese medicine, homeopathy, acupuncture, herbs, food. And they spent an hour and a half with me, and it changed my life. And I thought, gosh, I want to do what you do, and I think the time it was luxury that he had to help me figure out what's going on. And so that's how I became what I became. I had no idea what it even was or that it existed. All I knew is I wanted to help people and be a doctor. So yeah, that's how I got into this.
I like that idea of the Trimester Zero, because even though I did my training in OBGYN, and I think the covering of your prenatal care was take prenatal vitamins, and that's pretty much where it ended.
Yeah.
But as I'm getting more into the integrative medicine, I'm realizing how somebody explained it to me, that toxins that your grandmother was exposed to could be affecting you now. And I'm like, oh, mind blown. So,
I had no idea that when you have a female, if you are having a daughter in you, you're also carrying her eggs at the same time. So if you have a daughter, you're carrying your grandkids with you at that time. So whatever you eat, whatever is in you, however much mercury you have, you pass all that on. And so, yeah, it's crucial. And like, I remember my OBGYN and my midwives, who were much more holistic, they were also like, this is coincidental. It's, one in a million. It happens. It's not genetic. But then more and more patients would come to me with these kids that were so sick, in medical school. I don't remember seeing as much 20 years ago. Kids with autism, kids with allergies, kids with ADHD, kids on antidepressant at the age of 5, and I thought, gosh, what's happening? And so that's why I was telling you my specialty was in women's health, but I was forced to then focus on kids because the moms would all be stressed because of their kids' health. And I couldn't help the mom with stress and hormones if I didn't help their kids out. So I started looking at integrated pediatrics. And then further on, I started to see these kids. I would do toxin panels on them. And their mercury in their blood would be like 11, 12. And they didn't have fillings. They weren't eating fish or tuna. And I was like, how is it possible? Where's this coming from? And so the more testing I did, I saw, wow, so much passes on from mother to child. And then, like you said, to your grandkids. So I started talking to colleagues and friends of mine who were OBGYNs and realizing, yes, it's folic acid, prenatal, maybe if they were advanced, add in a prenatal DHA, don't do drugs, don't drink too much. And that's get your STDs tested, HIV, syphilis, and all that obstetric panel. And that was pretty much it. And that's what I had. But there's so much more nowadays. I think if it was hundreds of years ago, maybe it was simple like that. We didn't have all these xenoestrogens and EMFs. And I cringe when I see these pregnant women with their cell phones, like literally right on their belly all day texting, because I didn't know about that, and the skull of that baby is not formed yet. And it absolutely gets affected by all the radiation and things that to me, even as a scientist, was very woo-woo,
Yeah.
I think once I started to look at the research when I had to for Trimester Zero, I was like, wow, there is so much research on sperm count, egg quality in Europe, especially when it comes to EMFs. And I thought, why doesn't anyone know about this? And so I had my whole house measured. I had to get it tested. I had to see for myself, and I thought, wow. So there is a lot of research out there, and a lot more books are coming out. But still, my good friends who are reproductive endocrinologists, they still will say, nope, there's no proof. As long as there's no double-blind randomized controlled trial on every single thing, it doesn't make it into the guidelines and it doesn't get told. But we need choline, we need antioxidants, there's even research on mice, which I find interesting, that when they intermittently fasted, they had more egg reserve. It preserved their eggs for longer, which is interesting.
Wow.
To know that it does that with longevity, that with telomeres, so maybe we should be telling everyone not to just eat and snack all day, but telling our 20-year-olds, maybe skip a couple of meals here and there. Don't eat so much. I think that snacking five meals a day really did a lot of harm. And now, it's very trendy, but fasting has been around for thousands of years, So in the Trimester Zero program that I created, I really tried to look at where's the evidence, and not just double-blind placebo-controlled trials, but where is the evidence? It took me 13 years to make this course because I wanted to create thousands of babies until I was like, okay, this is what works. This is what helps prevent miscarriages. This is what you want to do if you're doing IVF. You should be eating a little differently than someone who's 23, and probably has pretty good eggs. If you have a family history of this, or you have these genetic SNPs, you really got to make sure you're helping your microbiome and making sure the bugs in your gut, the flora, are important. So alongside a prenatal, an OBGYN should be looking at stress levels, cortisol, the probiotics, the good bugs in the gut, because all that affects that immune system. And I think with the autoimmune diseases we see, and I'm sure you see with Hashimoto's and all of them so on the rise, one of the main goals of my program is to help optimize the immune system of the mother so that affects their child's immunity, and we'll see less allergies, less eczema. And so a lot of the issues is an OBGYN, you're trained to basically get that baby out, and then they go to the pediatrician, and then they see the gastroenterologist or the immunologist or the rheumatologist later on. But I think one of the curses of my job is I get to see it all. And I go, gosh, if only they knew what they did during that time and how critical it was. And maybe they could have prevented this when they're 50 or 60. There's lots of research looking at the Swedish and how they ate during pregnancy, and diabetes and obesity and heart disease 60 years later. And the links, everything is connected. So if we can get a good foundation as well as we could, that's key. I mean, you never buy a house without making sure the foundation is solid and it's not going to break on you. You never go make bread with like moldy flour and really bad ingredients. But unfortunately, when it comes to making babies, 50% are unplanned.
Yeah.
And the other 50, no one ever really looks at the sperm until like a year's passed and something is really wrong. And then they go, maybe we should look at the guys. But to me, I always say it's 50-50. Why do the guys get to do whatever they want? And it's typically blamed on the females. And we're seeing now the male infertility rates going up. And the higher they go, it's so interesting. The normal ranges for sperm count, mobility, they keep decreasing. Just because we can't have everyone be abnormal, right? So we have to keep decreasing it. Whereas 50 years ago, that wasn't the normal range. That was actually considered low and suboptimal. I'll stop there, but I could go on and on.
Yeah, that is great. So it's interesting how you brought up about the Trimester Zero, because, 50% of pregnancies are unplanned. It's a little bit difficulty to be like, okay, well, I'm going to be healthy now when it may be a little bit too late. So what should women be doing to prevent these things?
Yeah, so that's what comes into education. My goal is to get doctors and PCPs and yourselves. It's too late when you're trying. And so many people come to me when two failed IUIs and IVFs and they're 42. And, it's like, oh, I wish I had access to you 5 years ago. But we can start slowly. We can start, at least if you're going to prescribe birth control pill, put them also on a B complex and things that help with the depletion of the minerals that they're in, just in case they come off it. I mean, I have so many patients who also get pregnant on birth control, right? So it's just doing what you can to help make sure that the toxic load is low as it can be. So it's really the mother's role to educate their young. I mean, from now, my kids are reading labels. They know all about the plastics, and when we're at the grocery store and they get that receipt is toxic and it transfers you into your hand. So I've taught, it's just about educating. It's about simple things. Water, making sure your water is clean and it's not full of chlorine and chloramines, not drinking out of plastic water bottles, household cleaners, bleach, doing the best that you can to educate them when they're teenagers or even younger, so that they already have a pretty good foundation. And figuring out if something is wrong, if their hormones are messy, if they're irregular cycles, that you catch these things early. I think right now it's so trendy to get your eggs frozen really young. I can't tell you how many of my females get their eggs frozen and they have PCOS, but they don't know. And the doctor's like, wow, you have so many, follicles and it looks great. And then now they're 41 telling me none of them were viable. None of them were good because they weren't really mature. So making sure from Menarche that we are actually looking at how regular their cycles are. Do they have symptoms? But a good nutrition, a good 80-20 rule, what I say is 20% of the time, if you're eating out, you're out with your friends, go do whatever you want. But just choose wisely, If you're going to have fast food, pick one of the better fast foods at least, and try to get diverse in colors and have fun with food, make cooking something fun that we all do together, and they learn from us. They model our behavior. So I can't tell them to eat a certain way and then go sneak a Big Mac, or whatever down, and then be caught or not be doing all the things I do. So the smoothies and green juices and things like that, you got to get them involved so that it becomes habit young. But for those of us that's not how they live, they don't have access to that, they don't have access to that education, that at least 3 months before they're even thinking of having a baby, they're put on a good prenatal, because many of us naturally fast in that first trimester. The body's very smart. It has something foreign in it, and you get nauseous, right, from all the extra hormones, and you don't eat. So you want to make sure nutritionally you're sound, so that you could, when you pass all that on while breastfeeding, it's the mother that becomes very deficient in calcium and iodine and all of that. So I really want to build her up so that she can sustain motherhood and have enough energy and not be so depleted postpartum. I would say it's really important for whoever's around you. As soon as you know you want to have a child, to me, that's trimester zero. Obviously, the 3 months before is when the egg and the sperm are really crucial. You get a new batch of sperm, and the eggs takes that much time to really affect it. But to me, anytime you start knowing that you want to have a child, so whether you're 20, 19, and you want to have a kid, you want to start that lifestyle slowly changing. You don't want to do everything and all the drugs and drink and do everything and kind of destroy your body, and then get to a point you're like, okay, I'm 35, I've met my man, here I go, what do I do? 3-month plan, change, I mean, it's better than nothing, but ideally you start these things earlier, one at a time, bite-sized things.
I was thinking about what you were saying with the drinking and the partying. I mean, that's kind of what college age students do. So how do you, I guess, get that message to a college age student that could be affecting their future children?
Yeah, I do. And I'm realistic, because I remember those days, but I say, okay, if you are going to drink, at least choose this. Don't have too much wine and beer that hormonally can have an effect. If you're going to have alcohol, maybe get the pure alcohol without all the sugar added to it. And then take a good B complex that night, and take some glutathione to help your liver detox it and get rid of it quickly. Make sure you're hydrating, right? So at least if you're going to do those things, add the things to support your body so it doesn't do as much damage. So the goal isn't to be like, you got to be robotic and not have fun, but it's important to educate, especially certain drugs. It's not about getting pregnant. I mean, I've had patients, cocaine addicts, who have had healthy children. And I myself, who I was considered very healthy, had an unhealthy child. So it's not black and white. But we do know scientifically that, oxidative stress damages the eggs. Same thing with the sperm. So what creates oxidative stress? It comes from environmental toxins. Even thoughts have been shown to change our neurochemistry, right? So I'm more interested in my teenage girls and guys who are doing those things as to what motivates them to do it, right? So there's no judgment, but it's educating them very frankly as to forget having kids in the future. I want you to be healthy, right? The healthier you are, the healthier your offspring and the chances they have. So you don't want to change things out of fear either. So I don't scare them and say, you're going to have an increased risk of this and that. No, I want you to just know that, is this really good for me? Am I loving myself enough to take care of this one body, this one liver, this one, heart that I have? Am I doing the best? And if I am, in moderation, enjoying myself, that's fine. It's normal to live, but just know that you won't be able to maintain this for life. Like, I remember the days when we used to drink and I'd be fine the next day. Now I can't do that. I can't tolerate that. I'll have one glass of something and gosh, I'm like a mess. And so I know my liver just isn't as strong as it used to be. Right. And so if someone had told me then that this would happen, would the pain be enough for me to have changed? Probably not, but I always say, look around you, look at your friends' kids, look at how many people are going through IVF, look at the fertility issues people are having. I mean, it is skyrocketing. Like back in the days, IVF was something like, 1 out of 10, 1 out of 20, 1 out of 30 of my friends. Now, so many people I know, like they're in their early 30s and they're already in that, and they've had 2 or 3 failed. So it's kind of scary, and you start to see all these kids that have more cancer, more autism, more issues. We got to wake up and go, what's going on? What is causing all this increases in all these diseases, And I think as a teenager, you don't realize that this could change your entire life. It could change your marriage. It could change how happy and great, how content you are with your life. we think we're invisible when we're invincible when we're young, and we just think, our body can adapt, and it does until they can't anymore, and then you start to see symptoms. So
I heard like nowadays we're exposed to so many more toxins than in human history that we've ever been.
Absolutely. And it's probably going to keep rising. I think every year when I update the course, I've just stopped, because I'm like, when I do it's kind of depressing. The slides that I have, with everything from the pizza boxes to the boxes of, all these preservatives. But also in the air, so much we can't control. Here in California, we get sprayed all the time. I see like dead bees outside my house all the time, and I know that they've sprayed and we're inhaling all those chemicals. We would never hold a baby's face and spray that in their face. We just wouldn't, but that's what's happening. We're putting chemicals on our skin, toothpaste with fluoride, the water, the air. So having a good air filter in the house, at least where you're sleeping, a HEPA filter, making sure you have a good reverse osmosis water system or something that's removing all the chemicals and then adding the minerals back in. Those are just basics. So doing that for yourself as a family, you've already helped those unplanned pregnancies, but also teaching your teenagers and your daughters and your sons that this is important. There's already so much chemicals, and we're looking at the meconium, the baby now, and the amount of mercury and BPAs and phthalates and the chemicals in there compared to 20 years ago is off the chart. So
wow,
coming just from the mother alone, I mean, no baby should have mercury in their poop the first
week.
It's neurotoxic, and so no wonder we're all brain foggy and depressed and anxious and on all these meds, because our cells just can't function. So in naturopathic medicine, we always say you start with removing the obstacles to cure, right? So the things that get in the way, heavy metals are one of them. And this is something, again, that was so like, ooh, heavy metals like happen like with Aaron Brockovich, like it's something that's just very rare in a remote city. But no, this is stuff that we're exposed to, even in the soil, even supplements, even herbs, even Chinese formulas. If they're not tested, you could be getting lead, you could be getting cadmium, you could be getting arsenic from your chicken and from your rice, So I do these advanced toxin panels after I run serum lab tests. But even the serum labs, I'm just surprised at how high. Everybody has mercury. And I had a 21-year-old last week who eats sushi every week, and her mercury was 15 in her blood, which to me, it should be 0. Like no one should have actually mercury floating around, because it turns into inorganic mercury and goes to the brain, and that's really what we're worried about, is the brain. So yes, taking a prenatal is important, or a good multi, but it's so much more than that. You individually have to see, what are my weakest organs? Is it my lungs? Is it my liver? Is it my digestive system? Is it my stress response? And for women, I typically find it's the latter. It's the stress response or their perception of stress, and that throws off their hormones. And then when the hormones are off, that's when dormant viruses, which many of us have, herpes 1, Epstein-Barr virus, cytomegalovirus, all these bacteria and viruses, that's when they thrive. They love it when those things are off so that they can replicate. And then we feel tired, we have sore muscles, we gain weight, we feel puffy, and we're told we have fibromyalgia or chronic fatigue syndrome, which to me doesn't mean anything. It means I don't know what's going on.
Exactly.
Often it's these viral flares because of hormone deficiencies, low progesterone, right? Progesterone goes down when we're stressed because your brain's in survival mode. It wants to make cortisol to help you survive. Your brain is not made reptilianly to thrive. It's there to survive. And so many of us are just barely surviving. We're floating in the water, but we don't feel like we got off shore and actually are thriving. And that's the missing link, is how do we balance life mentally so that when things happen, we have faith, we know how to go with it. We don't resist it. We don't judge it. We don't label it. We give ourselves permission to cry. We give ourselves permission to break down and say, I have to say, no, I can't keep doing this. This isn't good for me. Because often when I ask my moms, if this was happening to your daughter, what would you tell her? And it's amazing what they would tell her, but that's not okay for them to do themselves, you know?
I think a lot of times, because women, I think we just push ourselves for everybody else.
Yes. Yeah. That's our nurturing quality. You know, we're the givers, we're the nurses, we're the doctors, we're the counselors. A good therapist of mine that's male, he said, I'm pretty rare because we're usually the policemen, the firefighters, most assaults, most in the prison, most people that kill, you know, that we fight. We run away. When things get hard, we walk away. Whereas we care, we give sometimes too much, and over giving, overthinking, over worrying, that depletes minerals. It makes our body physically tired. And then we're trying to find the answer in a lab test, but often it's, you know what you need to do. You know, you need sometimes to say no and rest more, have fun more, be more social, go out with friends and do the things that make you happy.
So you've brought up a lot of things with the different toxins, and I know we can't get rid of everything that's around us, though I would love to. What are like some things that would be areas that people should focus on? I do actually have a lot of questions. You're the second person that brought up to me about the receipts that we get. And I never knew that about receipts having toxins and BPA. And now I'm like, every time I go shopping, I'm like afraid to like be touching and grabbing those receipts.
It's good to just not be too OCD. I mean, I still, out of rudeness, I don't want to be like, no, thank you, you know, but I really do educate the person. They're little, usually they're teenagers, they're young, you know, and they're touching like hundreds a day.
Yeah.
So I've seen at Whole Foods sometimes now they wear gloves before, but I've taught my kids and they'll see, like, I'll just hold it with my nails and then I throw it out, or I'll usually say, I don't need a receipt, thank you. But I did research on this and looking at jeans, brand new jeans, and the chemicals they measured in the blood. And I would never think jeans are going to get absorbed. You know, I always thought like it has to be cream or soft.
Yeah.
But like, it's crazy. So, you know, I didn't wash everything right away when I first bought it brand new, you know, but now unless it's organic, even if it's organic, you don't know where it's been sitting. But yeah, there's a lot of chemicals. Most of them we get from the air and then the skin. So again, it's mind blowing. It doesn't have to actually be a cream that you rub on. It can be anything sitting on your skin. It can be so toxic. So when you get your clothes, wash them the first time, wash them a couple of times. Try to get organic, if you can, organic cotton. But these chemicals, they're there. It's good to just see what you have, because like I have patients with kidney cancer, you know, and most often when I test them, their benzene levels are very high, off the chart.
Yeah, that makes sense.
And, you know, so I say, okay, you're going to get gas at the station, either go get a you know, Tesla or something that's, you don't have to get gas, or at least hold your breath. And, you know, every time you get gas, you get that sniff, you're getting that benzene going in. So it's these little things that, you know, I educate my patients on based on their lab tests. And I say, you know, you're actually doing pretty good. Your body's good. And it's also genetics, our genes, our detox pathways. Your body's meant to detox, but it also wasn't made to handle all these chemicals. So many of my, you know, medical doctor friends tell me like, you don't need to do a detox. Detox is all like, you know, woo woo, and everyone's trying to make money. And I go, you're right. Our kidneys, our skin, our lungs, our liver, they were meant to detox daily, and they do a great job, but they weren't made to handle all this. Plus on top of that, synthetic hormones and drugs and Zoloft and every other drug they're on, that's just filling up the cup, and that liver just can't tolerate. And so typically the symptoms in functional medicine we say of liver being burdened, number one is early aging, you know, so looking at your skin, looking at your grays, as I'm hiding mine, or aging, because that's what your antioxidants are made there, right? And then number two is fatigue. Number three is your vision. So as we age, I often ask, how is your vision? Do you need glasses? Like, has your vision gotten poorer and poorer over the years? And we know in hepatitis, anything that affects the liver opens up to the eyes, right? So in Chinese medicine, your vision is also very important for how much iron storage you have, your ferritin levels, and also the antioxidants that affect cataracts, right? And so as we age, vision goes down, dry eyes, headaches, especially behind the eye, is very much liver in Chinese medicine, and then biliary headaches, which is the gallbladder headaches, which is bile in the stomach that make you nauseous. If you eat a really heavy meal, like a big steak, and you feel nauseous after, that means your gallbladder is weak. You just secreted too much bile in the stomach, and bile needs to get out one way or the other. It either comes up this way or you get loose stools and it goes out the other way. So I find, a lot of times I have to educate my patients, just because your liver enzymes are fine doesn't mean your liver's working well, right? And we don't want it to start being elevated. That means it's really damaged, right? So that's what I'm looking at a lot of times, is how to optimize their gut function first. And it usually starts with the liver and the gallbladder, believe it or not the stomach. So HCl production as we age, we know, goes down. So most of us have low stomach acid as an 80-year-old. That's why our appetite is usually lower. So your body's like, I'm not going to be able to digest as much, and we don't want to have a lot of meat and heavy duty proteins. But a 30-year-old or 40-year-old shouldn't be on an antacid. You do not have too much acid. You probably have not enough. And the food you just ate is sitting there because you don't have enough enzymes to break it down, and it backs up because it's not moving down where it should. And so often I'll actually take patients off their PPIs and their antacids and give them acid, and they're like amazed. They're just like, what? I don't understand. I thought I had too much from the burning. So fixing the gut so that you can really absorb your nutrients is where we always start.
It's amazing because I think about all my female patients that are on medication, for reflux and stomach, heartburn. And it amazes me because that in itself is affecting, the pH of the stomach, which then is affecting the pH of your intestines and is making things actually worse.
Yeah. So I think even in Barrett's esophagitis, because they're the only people where I will put them on antacids. But I was just reading research that even patients on antacids, when they have actual, dysplasia, it actually doesn't prevent cancer as we used to think. But I think that the difference in when you have 5-10 minutes with a patient and someone has burning and, and I got to fix it quickly, of course, that's what I would do, and there's nothing against that. But looking long-term, increased risk of heart attacks and strokes, B12 deficiency, all the deficiencies that come, you just want to know what you're doing. So I have no problem with anyone being on medications. I use them too, but just know what you're doing. Know that this is like, okay, I'm going to shut down the system, but for how long am I going to do that for? And what caused it to begin with, and so the antacid, yes, I find most people, it's just such a quick fix, but I guarantee most of us don't have too much acid unless, the sphincter is loose. And that's the other thing is I had a patient last week who said, when I tilt over, like I get that burning. And I go, yeah, that's not from too much acid. That's because it's loose. Like it's common sense, right? If that sphincter's not closed, your food's going to come out. So how do we close that? What controls that? That's your diaphragm. Your diaphragm is holding that. And so if that muscle is weak or you're sitting all day, so she's at the computer all day sitting, doesn't really exercise, and then drives an hour home. And as soon as I touched her diaphragm, she cringed. And I'm like, it's so tight. It's just like any other muscle. So teaching her to use the diaphragm, I'm sending her to yoga every week just so she can learn to use her belly and her diaphragm to breathe with it. I had an amazing gastroenterologist as a mentor who would put belts around everyone and get them to breathe into the belt, to push that muscle out, to get the diaphragm working, to close that sphincter, So it's the pathophysiology. I think sometimes we forget, like, what's really happening here, And,
I'm going to go back again to the Trimester Zero. What are there key things you would tell people to do during that time?
Yes. So number one is remove the things that are bad for you first, right? So things like we just talked about, the chemicals in the household, water, air, basic things, things that I guess to me are basic now, but for some people that's so much. I have so many patients who are like, what shampoo do you recommend? What makeup line should I use? Should I dye my hair? If I get my nails done, what about like every time you walk into that, so just starting there is key because those chemicals get passed down. And then secondly, making sure you're getting your hormones and things checked early, because sometimes you have an autoimmune disease you didn't know about. Sometimes you find out your TSH, your thyroid level is really high, and that could be getting in the way, and so you want to fix those things and give yourself at least a year, if possible, if not 6 months, and not feel panicked that, oh my God, I wanted to get pregnant yesterday and now I found all these issues, because that anxiety and that stress will get in the way. What else? I do detox a lot of my patients, and by detox,
and how do you detox?
I mean medically detox. I mean, if their mercury, which is my number one heavy metal that I'm looking for, is high, I will use a very safe protocol by Quicksilver Labs. I used to chelate a lot of patients back in the days when we thought chelating was a lot safer than I think it is now, because when I chelate, it means I go and give you a drug that's going to disassemble that mercury that was bound to something and then hope that you're going to excrete it in your urine. But we're finding that what if it goes into the brain? What if in the process, I don't know where it's going to go, right? So mercury amalgams, I have my women, cut out a lot of the tuna that they're eating or foods that might be harming them, making sure they're not inflamed. Inflammation is no good for egg and sperm, and neither is too much insulin and dysregulated blood sugar levels. So making sure they're eating well. And so I put them on my Trimester Zero diet. And this diet is tailored to them. But basically it means I actually don't want them to eat a lot of raw foods. So in Chinese medicine, when you're eating salads all day, it's actually hard to digest. If you're eating raw broccoli, raw cabbage, raw anything too much, it's actually not what we give babies, right? What do we feed babies that's easy to digest? We puree the food, we cook it, we steam it. So often I'll find they're so nutriently deficient and they're trying to lose weight or trying to just maintain life. So they're grabbing a salad to go all the time. And of course, greens are very, very important. But you want to have more soups and stews and things that to help build your blood and bring that blood to the arteries down there, right? So if you're sitting all day, I get them to go and exercise and really bring blood flow to that region and make sure that the lymphatic system there, everything is nice and open. No ovulatory pain, so no mid-cycle pain. And for them to feel like they're getting their periods without knowing it's coming. So they're not that week before, really, really irritable or sad or a completely different person. No breast tenderness. So we'll do a hormone test usually around day 19, 21 of their cycle, post-ovulation, to make sure they're getting that high progesterone peak. And often I find they're not. They're very much either low progesterone or too much estrogen compared to progesterone, which is called relative estrogen dominance. What that can do is get in the way and also cause a miscarriage if you don't have enough. But if I don't find that progesterone and they are over 35, I'm thinking about egg quality, because you need a good egg to release that much in the luteal phase post-ovulation. So getting a really good assessment first, seeing if you can detox, and you can even do activated charcoal. You can do zeolite. You can do more fiber like flax seeds, ground flax seeds, 2 tablespoons a day to bind all these toxins in the gut. So it's through stools that we get rid of things, through urination, but also our largest organ of detoxification is actually your skin.
Yes.
So getting them to do simple things like dry skin brushing, just, or going to one of those Korean baths, spas, if you've ever been, where they spend like 40 minutes and they are scrubbing the heck out of you and you leave like 5 pounds lighter because of all the dead skin. So
I was going to say, what is dry skin brushing? I don't know what that is.
Yeah, so basically before you get in the shower, you get those loofahs. You've probably seen them at the health food stores. They're kind of harsh. They're not the super soft ones, not the fluffy ones. And you are basically scrubbing your skin clockwise towards your heart to help increase the circulation and bring that lymphatic flow back up to the lymph nodes. So the groin area is very important, where the ovaries are, the abdominal region, under our arms, where all the breast tissue goes to. And you do this just before you get in the shower while the skin is dry. This is an amazing way for just 2 weeks. And the other one I love to help increase your white blood count in your immune system is called constitutional hydrotherapy. So this is using water like they used to use back in the days in Europe, where you take a shower that's hot and then you switch to cold. And you do this, you've heard of the cold plunges nowadays where everyone freeze their butts off. But this is very ancient. With the spring water they used to do is they would jump in the cold, go back to hot. And what this does is it vasodilates, vasoconstricts, vasodilates, vasoconstricts, which is a great way, again, to move the lymph out. So detoxing means you want to bind it and then you need to get it out, right? And you want to do these things daily to help you detox. You don't need to go on a crazy chelation cleanse or anything like that. You can do this every day or every week, you know, to help your liver, to help your lymphatic system. And then starting your morning with lemon water. That's one of my favorite things. Lemon juice in water. So just squeezing half a lemon. Make sure you're not drinking fluids that are too cold throughout the day, especially close to when you're eating. I find so many people have water with their meals.
Yeah.
That pH of that stomach should be so low that if I put my finger in your stomach, it should burn my finger. But I guarantee you, in naturopathic school, we used to send those little vials down, and no one was acidic, because we're just so either in stress mode while we're eating or in that sympathetic mode, but also we're diluting our stomach acid with so much liquids. Because in the Western world, they always say, what would you like to drink with that? Right? So we want to make sure you're not so acidic. You're not diluting that acidity with water. So I start my mornings with lemon water, and then I have a little rebounder. So a little mini trampoline right under my bed that I pull out from a company called Bellycon. And 5 minutes, I just do jumping jacks, because all night is when you detox. That's why that urine is so dark in the morning. And that's when you want to really support your body. So taking that shower, the hot and cold shower, rebounding for 5 minutes, having your lemon water, and then just going about your day, you've already helped your body, and you'll just feel energized. And it doesn't, I mean, I'm a cold person to begin with, so I cringed when I heard about the cold water. I was like,
yeah, I know, I did too.
I love my super hot showers that burn your skin. But you just cooler. You don't want to go like ice cold.
Okay.
30 seconds, you know, and then you go back to the hot, and it's amazing. You do this for a couple of days, then your body just craves it. But I guarantee anyone who wants more energy and weight loss and to help your immune system, it increases white blood counts in doing this for 2 weeks.
Wow.
Life-changing. So, and it's free and it's cheap, you know.
Yeah. Yeah.
Chlorine filter on your shower head to not get all that chlorine in. But yeah, that those are simple things I do. And then, you know, trying to fast here and there. If you're cycling still, for women, you don't want to go keto or fast right before ovulation. And then in the luteal phase, when all that progesterone needs to be made, we need carbs. We need complex carbs.
Maybe that's why I remember I used to crave carbs during that time.
Yeah, there's a reason. You don't want to have like chips and white rice and, you know, crappy carbs. You want to have like sweet potatoes and maybe some potatoes with the skin on, and pumpkin, and all those root vegetables are really great. But yeah, other than that, it's a great time to fast. You know, so going 12 hours between dinner and breakfast, going up to 14 and then 16 and then you're doing 18, or intermittently fasting, saying like, I'm not going to eat at all today and just have water. So I always know how healthy someone is by how well they fast. So if someone absolutely can't go on 4 hours without eating something, there's a problem. That hypoglycemia, there, that's not normal, right? So I used to have that. I always had to have a snack on me. If I didn't, I'd be hangry, I'd get a headache, I'd get shaky, I even fainted at school once, you know? And I just thought, oh, that's what I have. I have hypoglycemia. For the rest of my life, this is how I should eat. Until a doctor told me that's not normal. That's not healthy. You should be able to go 72 hours without eating anything and feel great. You increase mitochondria when you fast. You should feel energized. Your mind should be sharper. And I thought, oh shit, how am I going to do this?
I've been there too, because I remember when I used to eat crappy and when I was eating a lot of processed foods and a lot of sugars, like I couldn't go 2 hours without feeling like I was going to faint. And my husband thought I was crazy. He's like, man, you're weak. Because he can go, you know, hours. And I just, same thing. I thought it was just the hypoglycemia, not the foods I was eating that was causing me to be like that.
Yes, absolutely. So then when you get off the fast, like you said, it's really important what you binge on or what you eat in that 4 hours or whatever hours you have. Yeah, if you're just trying to feed that glucose to the brain quickly, then you get stuck in that cycle, and you'll just have that spike in insulin and then drop and spike. And so in a lot of my diabetic patients, I always go, it's not too much sugar that caused it. It's the drop in the sugar that made you want that, dessert or the sugary thing that let you here. No one just was born with that. So it's important to get enough fats, healthy fats, so avocado a day, nuts and seeds if you can tolerate it. So much that we forget that can be really yummy. Having an apple with some nut butter on it, with an egg and some, I try to keep fruit away from meals. So if I'm going to have fruit, I keep it by itself, not to mix fruits with veggies with protein, and it's just too much. So keep 1 or 2 or 3 ingredients at a time. Don't overwhelm your system with too many messages so it's easy to digest. And if you're having issues with digestion, you get really bloated, you get really full after something heavy like meat, then a digestive enzyme or apple cider vinegar in some water or taking bitters before your meal can help you digest. So start with digestion and detoxification daily. Make that sort of a goal every day. And my other last tidbit is sleep. I think when I was younger, I could get away with, less sleep. But the older you get, you realize how important sleep is for everything. So I always say I'm super lame and I go to bed at like 9:39. Sometimes I listen to my body. When I'm tired, I go to bed, and that really, I think, helps because I always wake up without an alarm and ready to go refreshed. So you want to wake up refreshed. If you're not, sleep is not good, and you got to fix that first. The first foundation to health is good quality, deep sleep.
Great. You have so many wonderful tips. I really appreciate it. Where can people find out more about you and about your course?
Yes, so I'm pretty social. I'm on Instagram at Dr. Demeri, Demeri. And my course is at trimesterzerocourse.com. My website is aimforwomen.com. And yeah, I'm happy to answer any questions on Instagram. And thank you so much for having me.
Thank you very much.
All right, bye-bye.
Today's episode was brought to you by the Pelvic Floor Store, your source for personal health. You can find us at www.pelvicfloorstore.com. For more information on today's episode and women's wellness, please go to drbetsygreenleaf.com.